Good morning and hello everyone. My name is Wan Hana Binti Husni. I will discuss today's topic about the social perspective of inequalities of healthcare in rural areas. Can you imagine living in a place where access to quality healthcare is luxury rather than a basic right? This is the reality for millions living in rural areas in Malaysia. Despite significant advancement in medical science, the healthcare system still fails to bridge the gap between urban and rural population. Healthcare inequalities in rural areas manifest in various forms, including a medication, shortage of medical professionals, outdated facilities, and limited access to essential medication. According to the World Health Organization (WHO), rural populations are twice as likely to suffer from preventable diseases compared to their urban counterparts. The disparity leads to delayed treatments, misdiagnosis, and a higher mortality rate. In the short term, untreated illness cause reduced productivity, financial strain, and lower quality of life. If in the long term, these inequalities perpetuate a cycle of poverty, hinder economic development, and widen the social gap. The core issue is the systematic neglect of rural health infrastructure and resources. Rural areas face a disproportionate lack of funding, skilled healthcare workers, and adequate medical technology. This problem primarily affects rural residents, particularly low-income families, elderly individuals, and children. Several health issues such as maternal mortality, preventable infection, and chronic disease are more prevalent in rural regions. In the short term, rural residents endure unnecessary suffering and economic hardship. In the long term, this neglect perpetuates generational health disparities, lowering life expectancy and deepening inequities. If this issue remains unaddressed, rural communities will continue to suffer from preventable deaths, strain local economics, and deteriorating social cohesion. The nation as a whole bears the weight of reduced productivity and higher public health costs. Addressing healthcare inequalities in rural areas is not just a moral imperative, it is an investment in social well-being. Improved rural healthcare leads to healthier population, economic growth, and a more equitable society. There is a way to transform this narrative from one of disparity to equity. By focusing on practical solutions, community-based solutions, we can bridge the healthcare gap in rural areas. First, we must increase investment in rural health facilities, ensuring they are equipped with modern medical technology. Second, Second, we must provide incentive for healthcare professionals to work in rural areas, including scholarship, loan forgiveness, and competitive salaries. Third is we must leverage technology to connect rural residents with especially in urban centers, reducing the need for travel and enabling faster diagnosis. And lastly, we must train local health workers to provide basic care and education, creating a sustainable support system within the community. We have the tools and knowledge to solve this issue, but we need your support. Advocate for policies that prioritize healthcare, rural healthcare funding, encourage partnership between governments, NGOs, and the private sector to develop sustainable solutions. Most importantly, raise awareness about this pressing issue is in our networks. To conclude, healthcare inequalities in rural areas is solvable problem. By addressing this issue with urgency, we can create a future access to quality healthcare is not determined by geography. Let's work together to ensure that no one is left behind regardless of where they are. Thank you so much.